Hi, my name is Mark and I'm a physical therapist. I work with people in chronic pain. I work with clients both virtually and then also in person in New York City. So as I do with all of my patients with lower back pain, I'm going to take you through a movement screen that's going to give us information about how your body feels in certain positions and with certain movements. With this information, we'll be better able to make decisions about which exercises are going to make you feel better. Developing a good relationship with a consistent exercise routine that's tailored to you is key to getting back to the things that you love doing. Be Well will help you make those decisions and make that program, and it starts with this assessment. Before we get moving, it's important to know a few things about your pain. If your pain is the result of an auto accident or a trauma such as slipping and falling down the stairs, then you should be evaluated by a physician in person in your area if possible. If your pain, however, is something that's been going on for 3 to 4 months, you've been evaluated, maybe you've seen another medical professional about this, and it still hasn't gone away and you're just looking for another option, then you're in the right place and we can continue. Okay, so we're going to evaluate 4 different movements: bending forward, bending backward, bending to the sides, and rotating. After we're done with those movements, you'll be prompted to rate those movements on a scale from 1 to 5. 1 being no pain whatsoever, 5 being an unbearable amount of pain. So you can use a pen and paper to keep track, or you can just take a mental note. That's up to you. All right, let's get started. The first movement we're going to try is the forward fold. Now, if at any point during this exercise you start to feel pain in the lower back, you don't need to continue. Stop where you are, evaluate the pain, and then bring yourself back up. So we'll start with your feet about hips width apart, knees pretty straight, and we're going to start from the head. So tuck the chin to the chest, roll the shoulders forward, and start folding down from the upper back to the mid back to the lower back, and then the hips go as far down as you feel comfortable, and then bring yourself back up. Very good. Don't forget to take a note of how much pain you experience with this one. The next movement we're going to try is backwards bending. So we're going to start in the same position as the forward fold, feet about hips width apart, knees pretty straight. For this one, I'm going to have you place your hands on top of the back of your pelvis. We're going to look up and bend backwards as far as you can. Again, stopping whenever you start to feel that pain, if you do feel it, and then bring it back up. Don't forget to note how much pain you experienced on this one. Next, we're going to test side bending. So, same basic position. We start with the feet about hips width apart, hands by your sides. We're going to stand up nice and tall, and I want you to reach your right hand down the outside of your leg towards the outside of your right knee, and then back up. Same thing on the left side. Reach that left hand to the outside of your left knee and back up. And now between both sides, if you experienced any pain, I want you to rate that pain on a scale from 1 to 5. Lastly, we're going to test rotation. So I'm going to turn around for this one, but the starting position remains the same. Feet about hips width apart, planted on the floor. And I want you to turn back and rotate as far to the right as you can. Turn back to the middle. And then turn as far to the left as you can. And then again back to the middle. Make note of how rotation makes your back feel, regardless of the side for now. Make sure you rate that on a scale from 1 to 5. This concludes our movement screen. Starting tomorrow, you'll receive exercises based on your responses to the movements today, so try to be as accurate as possible. Every day you'll receive new exercises, and the ones that are helpful to you and the ones that you like, you'll be able to add to your routine. Tap below to review the movements.